Good morning, everyone. Welcome to our first session in the BSc Nursing first-year course under KUHS. Today, we're going to begin with an exciting topic, applied anatomy, focusing on sensory organs. In this presentation, I'll guide you through the basic concepts of sensory organs, their structure, and their function. We'll look at how these organs help us perceive the world around us. So, let's get started and explore the fascinating world of sensory organs together. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about how our human sensory organs play a crucial role in helping us perceive and respond to our environment. These organs are essential because they allow us to gather information from the world around us and react accordingly. The major sensory organs include the skin, which detects touch, temperature, and pain, the eyes for sight, the ears for hearing and balance, the nose, which is responsible for smell, and the tongue for taste. These sensory organs are not only vital for daily functioning, but are also key in health assessment and patient care. By understanding how these organs work and recognizing signs of dysfunction, healthcare providers can better diagnose and address various health issues. Throughout this presentation, we'll see how these sensory systems integrate into overall health and how they can guide our clinical practices to improve patient outcomes. Let's take a closer look at the structure of the skin. The skin is made up of three main layers: the epidermis, the dermis, and the hypodermis. Each of these layers has a specific role in maintaining our health and protecting us from the environment. The epidermis is the outermost layer. It acts as a barrier against environmental damage and helps prevent water loss. Beneath that, we have the dermis, which provides strength and flexibility, housing blood vessels, nerves, and skin appendages. The hypodermis, or subcutaneous tissue, anchors the skin to underlying tissues and contains fat that insulates and cushions the body. Speaking of skin appendages, these include hair, nails, sweat glands, and sebaceous glands. They all serve various functions, from temperature regulation to protection and sensory input. For example, sweat glands help cool us down, while sebaceous glands produce oil that keeps our skin moisturized. Finally, the key functions of the skin include protection, acting as our first line of defense, sensation, allowing us to feel touch, pressure and pain, and thermoregulation, helping maintain our body temperature. Together, these aspects highlight just how vital our skin is in overall health and well-being. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at this skin diagram. As you can see, the skin is a complex and vital organ composed of multiple layers. The outermost layer is the epidermis, which acts as a protective barrier against environmental damage and helps prevent water loss. Beneath that is the dermis, a thicker layer rich in collagen and elastin fibers, which provides strength and flexibility. The dermis also contains important structures like blood vessels, nerve endings, hair follicles, and sweat glands. Understanding these layers is key because they each play a role in how our skin functions and responds to injury or disease. This diagram helps us visualize the intricate architecture of the skin and reminds us of its importance in overall health. When we consider skin conditions or treatments, knowing this structure allows us to target specific layers more effectively. So, this diagram is not just a static image. It's a map that guides our approach to dermatological health and care. Now, let's take a closer look at the structure of the eye. The eye is made up of several layers, starting with the sclera, which is the tough, white outer layer that provides protection and shape. Beneath that, we have the choroid, a layer rich in blood vessels that supplies nutrients to the eye. And finally, the retina, which is the light-sensitive layer at the back of the eye responsible for converting light into neural signals. Moving on to the parts of the eye, we have the cornea at the front, acting as the eye's primary lens to focus incoming light. The lens itself then fine-tunes this focus, working together with the cornea to create clear images. The iris controls the size of the pupil, which is the opening that allows light to enter the eye. And the optic nerve carries the visual information from the retina to the brain for interpretation. All of these components work seamlessly together to make vision possible. They are responsible for perceiving light, forming images, and ultimately enabling us to see the world around us. This structure highlights how complex, yet efficiently designed our visual system truly is, connecting the physical parts of the eye to the incredible function of vision itself. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the structure of the ear. The external ear consists of the pinna, which is the visible part you see on the side of your head, and the external auditory canal, which carries sound waves inward. Moving inward, we reach the middle ear, where the ossicles are located. These tiny bones, the malleus, incus, and stapes, work together to transmit sound vibrations from the eardrum to the inner ear. Deep inside, we find the inner ear, which houses the cochlea and the semicircular canals. The cochlea is essential for hearing, converting sound vibrations into nerve signals that our brain interprets as sound. The semicircular canals, on the other hand, are key to our sense of balance. Together, these structures serve two main functions: hearing and balance. They work in harmony to help us perceive sounds around us and maintain our equilibrium, which is vital for everyday activities and overall well-being. Understanding the ear's anatomy helps us appreciate how complex and finely tuned this system really is. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the external nose and the nasal cavity. The entire area is lined with olfactory epithelium, which is specialized tissue responsible for our sense of smell. This lining contains sensory receptors that detect odors, making the nose essential for our olfactory function. But the nose isn't just about smelling. It also plays a vital role in filtering the air we breathe in, trapping dust and other particles to keep our lungs clean. Additionally, it humidifies the incoming air, helping to maintain proper moisture levels in our respiratory system. Understanding the structure of the nose helps us appreciate how it supports multiple functions: smelling, filtering, and humidifying, integral to healthy respiratory health. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about the structure of the tongue. First, it's covered with tiny bumps called papillae, and these contain taste buds, which are essential for our sense of taste. The tongue isn't just for tasting, it's also a muscular organ that plays a key role in helping us speak and swallow. So it's quite versatile. When it comes to taste sensations, we experience 5 main ones: sweet, salty, sour, bitter, and umami. These sensations come from different areas on the tongue, but it's important to remember that taste is a complex sense, and these areas are more interconnected than once thought. Overall, the tongue is a vital structure that contributes to our ability to enjoy flavors, communicate effectively, and safely swallow food. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Now let's talk about the assessment of sensory function, which includes checking pain, touch, vision, and hearing. These assessments are vital because they help us identify any sensory impairments early on. For example, recognizing hearing loss, vision defects, or neuropathy allows us to tailor our care effectively. It's also important to educate patients about the importance of hygiene and protecting their sensory organs. Simple practices like proper ear and eye care can prevent further damage and promote overall well-being. Monitoring any changes in sensory function during illness and treatment is crucial, too. Sensory impairments can sometimes worsen or improve depending on the condition or therapy, so keeping a close eye helps us adjust our interventions promptly. In terms of application and implications in nursing, these assessments and education efforts are fundamental. They enable us to provide comprehensive, patient-centered care that not only addresses current issues, but also helps prevent future sensory problems. Ultimately, understanding and managing sensory function enhances our ability to promote safety, independence, and quality of life for our patients.